let us start with our session. Welcome everyone to the session. Thank you for joining. Let me introduce about our speaker Rajesh. He is he's having good experience in healthcare. He have over 8 years of experience in IT industry, and he made significant contributions in healthcare and also in various other domains such as US payroll, HCM, and SharePoint. And today we are going to present a topic: US healthcare administration. Right, so we know what is happening from the. Am I audible now? Okay,
Yes,
sorry
ma'am.
for the low
Yeah,
voice.
now we can.
Okay, let us explore, from the administration side, how the enrollment is actually happening and what are the different periods available and how payers are actually processing it. So that is what we are going to discuss now. So Rajesh, over to you.
Yeah, thank you, Miller, and hello, everyone. Thanks for joining the session. So let's start. Yeah, so today we will be looking into the few topics. Just a quick recap on the US healthcare, and there going forward, we'll look into like what are the areas where the healthcare administration processors are considered in US, and like it's common, but yes, I've been specific to United States. And then on we'll also see how the enrollment procedure, the flow related to it, and the claiming process, uh, which will be an overview because I'll not be going in depth to the claiming process because we have a lot in one area, and then we'll conclude the session. So we'll be walking through these contents in the uh, going presentation. Um, yes. So in this slide, as you see, like we are going to discuss on the US healthcare, but I would first uh, would like to share with you like what are the common grounds of healthcare. So starting with the common areas. So healthcare is organized part of medical services, right? As you guys are aware of, and there are areas where we consider them as an individual or a certain community. So it involves like preventive, curative, like the rehab, the palliative care, and depending on the person's health needs, right? So the healthcare services are there only to deliver like the service to the patients basis on the person's health needs. So we'll have the trained professionals like the doctors, nurses, and the allied health professionals in part of healthcare. So coming on to the US healthcare, so in United States, the healthcare is viewed not just a medical interventions, but as a complex system like involving the patient education, disease prevention, early detections of and management of chronic conditions. So the in the healthcare part of US, we see all these areas, and the US healthcare system involves in multiple players. So how the healthcare I would say the companies work. So we'll have the private health insurance companies and the public government programs who will be involved in this healthcare system. So broadly speaking, so in US healthcare systems, it is designed to promote health and prevent diseases. And because of the characterized, I would say the complexity, the cost and disparities in accessing those systems, like we have the health insurance allies who are the heart of US healthcare systems, and they access various healthcare services. For example, like the employee sponsored insurance, which is one of the principal source of coverage. And we have Medicare, Medicaid, Kaid services for the low income population. Then we have the Affordable Care Act, expanded insurance coverage, and there are many. But as overall, the US healthcare services are majorly run by, I would say, the private health insurance companies and the public health insurance companies. So yes, so coming on to the next slide. So here I have clearly defined who are the private insurance companies and what programs like they do run as part of uh, the US healthcare, and we have like the individual health insurances. So these plans are usually taken out by individuals or families, like which includes like the health maintenance organization, which is HMO plans, the preferred provider organization, which is PPO plans, and then there are exclusive provider organizations, which is EPO plans and point of services. So these are the plans which are provided by the individual health insurance plans. Then we have group health insurance, we have long-term care insurance. So the group health insurance is mostly provided by the employees for their employees, and these plans cover a group of people, often at a low cost per person because the risk is spread across the group. So it helps in this sense. And the long-term care insurance is like the insurance covers services which are not only covered by the regular health insurance, such as nursing home care, and we also have in-home care for individuals with the illness, diabetes, and disabilities and other conditions as well. So the long-term care insurance goes in that sense. And we have the health savings account and short-term health insurance. So like these are the private insurance programs which I've listed out here. So who are the like I would say the insurance companies who have these plans for the members or the people around in US. We have the list of private companies like Aetna, United Healthcare, Cigna, and I would say like Anthem and the Kaiser. There are many insurance companies, but I have listed few of them in the private insurance programs. Then we have the public insurance programs, which is nothing but governed by the government of United States. So we'll have the federal and the state government collaborated together to work on these public health insurance programs. So we'll have Medicare, Medicaid, Children Health Insurance Program, and the TRICARE. So just an overview on these points, like if like Medicare is a federal program in US that provides the health coverages for the individuals age 65 or older with certain disabilities. So this is one of the largest insurance program in the US right now. And there are many, like I would say that many parts divided to the Medicare. We'll have Part A, Part B, Part C, and Part D, respectively. And we have this Medicaid, which is a joint for federal and state program in US. So that provides health coverage to people with low income, including like for the children, pregnant women, and low income adults. So that they can cover those health issues whichever these low income people have. And then we have the children health insurance programs, which is also partnership by the federal and state in US. And then we have TRICARE. So TRICARE is one of the program which provide comprehensive coverage to the military personnels. And yeah, so I am going before moving on to the healthcare administration. So I just wanted to give a heads up on the provider part, like who are providers, who are payers, and their health cost terminologies, because these are the day-to-day, I would say, the terminologies which have been used often. Maybe you guys are aware of it, but I would like to just run through for the newbies. So the providers like are the healthcare providers in United States are like the individual or organization that deliver medical services to the patients, and they play a crucial role in healthcare delivery. And they have the range of professionals and institutions around US. So we'll have providers like physicians, nurse, dentists, pharmacists, hospitals, then long-term care facilities. We have the mental health professional facilities, then physical therapists, the laboratories who provide diagnostic services like blood test and radiology services. So these all come under one umbrella called providers. And then we have the payers. So the payers refers to them like the entities other than the patient that finance or reimburse the cost of health services. So in most cases, the health insurance companies are the primary payers for the healthcare services. So we'll have the primary health insurance companies, which I right now listed in the previous slides, like the Aetna, United Group, and Anthem. Then we have all the government and the federal and the state government who provides their medical facilities related to Medicare, Medicaid, TRICARE, and all areas. And yeah. coming on to the next slide, which is on the health insurance cost terminologies. So we have many terminologies, but I'm going to go with the most important and regularly used terminologies, which is co-payment, deductible, and co-insurance. So co-payment is nothing but the contribution which an insured person do like pay towards the cost of medical treatment services. Then the deductibles is like the amount of money an insured person has to pay before the insurer covers the cost of medical expenses. So you see an example right now here. So let's say there is a deductible of $2,000. Patient goes for I would say, a visit where he has a pain in a knee, or he has any issues, any kind of issues. He gets it and he visits for it and he pays $1,000. So here also the insurance company doesn't cover it. So it's like he still have $1,900 to reach the deductible. So same way he goes on the various processes, like he visits again and he says like, okay, there are certain other treatments, basic treatment needs to be done. So he reaches the deductible of $2,000, and once he reaches that, and any other amount after that is being covered by the health insurance company. Then we have co-insurance. So it is nothing but the percentage of cost of service is being paid until you reach the pocket maximum, out of pocket maximum. So if an health insurance, like an I am a member of an organization, I am go with the co-insurance type of facilities, I'll have to pay 20 percentage of like the cost first, and then the remaining 80% will be covered by the health insurance. So now coming on to the major part of the session, the healthcare administration, because I just wanted to give an overview, like what is US healthcare, what are the basic terminologies, who are provider payers, because going forward I'll be using those terms often. So let's explore about how healthcare administration directly benefits the common person. So we have the access to the quality patient care. We'll have the effective resource allocation, the patient safety and compliance, financial assistance and billing, community healthcare programs. So basically, in a healthcare administration, there are many categories, but I've listed few here, where administrators take care of the quality of the patient care, right? So healthcare administrators work behind the scenes to ensure that the medical facilities are well managed and equipped. So their effort leads to the efficient processes like shorter waiter times, improved access to medical services for the patient, and like effective resource allocation is like where the administrator allocates resources like staff, the equipments, the strategies, like okay, to ensure that the patient receive timely care without any necessary delays. Then safety and compliances come into the protocols and regulatory standards. Like by maintaining the compliance, they protect the patients from risk and ensure their safety with a safe environment. And then financial assistance and billing. So here's where the administrators handle billing, insurance claim, and financial assistance program. Because when a member is being admitted to a hospital, it's the yeah. So it's the I would say we'll have to when a member is admitted to the hospital, the insurance claim, the billing processes, the financial assistance programs, everything has been taken care by the providers, because behind the scene he's not going to go and work on it, right? Yes, there'll be some assistant around the members, but still the administrator side of the healthcare providers do follow these processes, like they handle billings and insurance claims and stuff. Then we have the community health programs, where the administrator collaborates with community organization to promote the preventive care and health education. So these are the initiative benefits that can help the common person by raising awareness programs and preventing illnesses. So the healthcare administrators also go ahead with the community health programs. And then there is also an administration process where they also prepare for the emergencies. So we never know, right, when the emergency can come out, when it can break out. So in that case, the administrator would directly impact the community abilities to make sure everything is being aligned, so that any disastrous event happens, everything is being taken care of. So this is the highlight of the healthcare administration. So these are the key points which I've mentioned in this slide. So now coming on to the healthcare administration need. So basically now you see an image where people are standing in a queue. So how healthcare administration has been improved because earlier days when you used to go to any healthcare provider center or any hospitals, you go there and you'll have to go stand out, fill up the form, then have it recorded. They'll take several days to give you appointments, and then the doctors would used to be available for it, and then you used to get your whatever issues being rectified, right? It used to take a long time. And nowadays, because of this healthcare administration process which been implemented in several areas of healthcare, it has literally helped many of the members or the person who goes to healthcare get it sorted. So, and one of the greatest boom is like the IT system has started boosting the productivity of it, like cutting the waiting time, enhancing the healthcare administration. And the major part is like the implementation of EHRs, like the health record system availability. So because of this, what has happened is once this implementation of EHRs was done, so the average patient stay at hospital was reduced to 53 minutes. So this was one of the, I would say, the research which was done by the internal medical research founders. So whatever happened after this implementation, it has covered and reduced more amount of time rather than people waiting for their things to be addressed. So like online scheduling system has reduced the waiting time, like where you can book the appointment, you can cancel the appointment, you can reschedule their appointments based on their convenience. So yes, because of these delays, the IT system has also helped a lot in healthcare administration. So I was just explaining you the fact, right? So this was one of the major fact, like it has reduced the patient's like waiting time to 53, average of 53 minutes. So this is one of the fact. And yeah, so I was just explaining about the healthcare administration, like how the people manages the areas of how to provide services to the members who admits to the hospitals. So at the back end, how IT system does uh, the processes to make these all overview areas to be simple. So we like have the enrollment procedures. So we have certain life events in US. Basis on that, you get enrolled into certain insurance plans. So we'll have the list of qualifying life events, like getting married, having a baby, adopting a child, loss of family member. Then certain like adults turning 26 with the insured parents policy, they go out of it. So there are many enrollment procedures which has helped a lot. So we'll have this enrollment flow. So how the healthcare administration does it. So say for example, there is a form which IT system has already built. So it has been shared with the employees or any other customers. So I have given a flow chart here which will give you an overview like how the processes are. So employee registers and then he chooses the insurance plan. So there are many insurance plan right now, right? We'll have medical plan, we'll have dental plan, we'll have vision and the life insurance. So once the employee or the customer or the member, anyone enrolls into these plans, the data is being stored in one of the ITDBs. So these data once are stored. So basis on the plan type, whatever insurance has provided to the employees or anyone, it goes, those information are shared to the respective vendors. I would say the insurance companies, like you have, I've listed out few like the CVS Health, Cigna Health. So it's like, say, for example, medical plan, it goes with United Healthcare. We have vision care, which goes with the Cigna, and CVS also do that, like provides them. So basis on that, so the employee has to enroll in some himself into these areas. So once he enrolls into that, all the information is being shared to the respective vendors of the health insurance companies. So once that is done, it and you also see like it's not like it's done a one time job. It is like on a continuous areas. Say for example, you have the open enrollment in the month of November in United States. It depends on the company, but the majority of the organization go ahead with now a month of November, where they tell the employees or anyone to enroll themselves into the insurance plan for that respective annual year. So say, for example, in 2024 annual enrollment, we have the upcoming month, November. So for the future enrollments, we'll tell the employees to enroll. So whatever areas they want to enroll in, whatever plan type they want to enroll, the employees do enroll it, and those information are shared to the insurance company vendors. So what happens is, like, say for example, in the month of February, one of the member is sick and he falls ill, like, and he wants some treatment to be done on the medical forefront. The insurance like, and the so the respective member has been admitted to the hospital. So what happens is, the healthcare administrative providers, they start with the billing cycle and all. They go and apply for the claiming processes, where they apply for the claim, and during that time, when the claim has been sent to the insurance company do go and check their respective database to see if the employee has been enrolled in the respective insurance plan. If he is not, then there is like backend processes where it go like the employers or the insurance company go and reach back to the employees with the certain data to cross verify whether he has been enrolled into that plan earlier and whether the data was not sent back to us. So there are many events which make sure that everything is smooth, so that the patient doesn't have to pay anything from his pocket. But yes, because of this administration process, like I would say, like there are like about 90% of the claim are being provided to the employees cashless. And yeah, there are certain areas where there are discrepancies of data which happens in this area. So during that time, the healthcare providers do get tell the patients or the members to pay for the amount, and then later get reimbursed from applying the reclamation. So yeah, so this is the basic enrollment flow which I was trying to explain. So, and then I was just talking about like how the data are being passed, right? So like the health insurance companies, they come up with their own format. Like say for example, expect the certain formats, and I've just given an example. Say for example, there are certain employees who have enrolled into medical, dental, vision, and all health plans, and they have enroll into these. And if you see like the format of the sample CSV file, we have these records being shared to the respective insurance companies. So here, I'm not saying that this is the exact format, but it do change based on the needs of the insurance company, like how they want the data to be handled. So this is one of the examples where like if you see in the previous slide I was sharing, like the data is stored in the IT company. So every week, so it's up to the company, right? Where they expect, they want the data on the weekly basis or bi-weekly basis or monthly basis. So the IT system has the process where they do send the data to the insurance company basis on their needs. So these data has been transferred to the insurance companies. So yeah, so this is where the claim process comes up, where the member files for the claim, he fills up the claim form, then the member is admitted to the hospital, the member is treated, all the processes are done, the insurance company approves. So this is where I was just trying to tell you, like when insurance company do their own scrubbing of data and all stuff in the claim processes, what happens is they do check these information which I've been explaining you earlier on the data front. So all these data have been evaluated, and then all the claim process has been approved. So if it is approved, then the hospital team receives the payment, and if not, then the member has to complete the payment, and then the member is being discharged. So I don't want to dig in deep on the claim process because it is so depth. So this is just an overview, like how the claiming process is being done. And coming on to the data analytics in healthcare. So data analytics in healthcare is one of the, I would say, a booming aspect where it's really helping out many healthcare administrators, like identifying the targeted population. Like the data analytics allows the healthcare organization to identify specific population that are most needed of certain healthcare coverages. So if say, for example, certain geographical area, they expect like, okay, the members of are enrolling mostly in the medical, dental, and vision plans. Certain areas they go ahead with the life insurance or the, I would say, the accidental insurance because of the geographical area. So these certain data helps the healthcare administrators or the providers to target certain population, and predicting the enrollment patterns. So as I was mentioning, that healthcare organization can also predict the enrollment patterns. So like say for example, how his future demand is, because they'll have all the data with them about their members info, their family info, who are their dependents, who are their gain dependents, everyone. So they make sure that they enable them to allocate resources effectively and ensure sufficient health access. So by this, they can help them with the predicting the enrollment patterns. Then we have the improving the enrollment process also. Since I was explaining you the enrollment, that is a basic enrollment process, but it has been changed drastically nowadays. We have many tools coming up from the IT systems which provide an advanced enrollment processes, which reduces ample amount of time. But since we have not have the data with handy, so I'm not explaining and I'm not going to give you the 100% proof on it. But yes, many IT systems have literally helped the healthcare administration with the advanced enrollment processes. So data analytics can also identify the bottlenecks and the inefficiencies of the enrollment processes, like where the issues are. Since I was also giving an example where the data discrepancy happens, like the employee or the member has enrolled into certain plan, but the data is the updated data has not been sent to the respective insurance companies, and because of that, certain time claims get denied. So there are many, I would say, certain example companies like Fidelity and other IT system companies, and the who has these issues coming on a daily basis, and their associates track those and analyze like where the data has been not provided, where the data was not transferred to the employee, and all these data driven decisions and analysis have been taken care. So by like I would say, like identifying the bottleneck, it will really help to come up with the better enrollment processes. So yeah, so this is about one of the key trends like data analytics in healthcare we have right now. And yeah, coming on to the final part of the presentation. So you, as you guys are aware that healthcare administration will keep playing an essential role because they are optimizing themselves in certain areas of operations, guaranteeing them the top-notch patient care. It all happens when everyone in an administration process come together. So we'll have IT systems, we'll have the hospital providers and the payers. When the everyone are in one sync, all the processes, all the flow under one umbrella will be so smooth, so that the patient at the end of the day has not suffer. So that's one of the key aspects where healthcare administration really helps a lot. So with the ongoing progression in digital health and data-driven decision, the healthcare administration can set also some further development in upcoming years. So nowadays we have a new boom, which is artificial intelligence. So maybe certain IT companies come up with certain AI tools which will be way faster in data transmission on anything. There are certain key areas which the IT systems or the administration side can consider and go ahead with the top-notch patient care. Yeah, so I have a few quiz sessions as well. So I would request the participant to actively participate. It's just a few basic questions which I was explaining right now in the presentation. So let's start with the associates who are there. So please do come up and answer. It's just a basic questions which I've mentioned here. So the first question starts with like, what is the annual period when the individual can enroll in a health insurance plan? So any guess? So we have option A, open enrollment. We have purchase phase. We have application window, and D, we have Affordable Care Act enrollment. So any guess on this, guys? Come on, you can. This is this basic question. If it is
Looks
wrong, also
like
it's not a problem.
there is a competition between A and C.
Okay. Yeah, so the correct answer is the open enrollment. So that is the annual period when individual can enroll in a health insurance plan. So I was also explaining you guys, right? So there are enrollment periods and all. So it is in the month of like November. So that is where the open enrollment is. And coming on to the second question, which month does the open enrollment period usually take place for the marketplace? So right now I just gave you a hint. Is it March, November, December, or July?
would say a lot of B.
Yeah, it is correct. It is November because November is a time frame where the employers do notify the employees to enroll themselves into the medical plans and all the plan types because they'll have a window from the month of November till December first week. By doing this, what happens is whatever enrollment data has been like done by the employees, all the data has been collected and then shared to the health insurance team and everyone who are allotted to the service providers who pays for the services. So what happens is so that effective 1/1 the next year, there won't be any discrepancies and none other the health insurance team has to wait during the claiming processes. So the November month is one of the key months where all the employees do enroll themselves and so that they are prepared for the next year. If they have any issues in the first week and second week of Jan, it gets sorted out. And coming on to the final three questions. So, which online market allows the Americans to shop for or compare and buy the health insurance? So, we have eBay, healthcare.government, Amazon, and state websites. Come on, guys. There's no, I would say, uh, anything wrong here or some marks. I'm going to give it to you guys on the questions if you answer something wrong.
Say B. B is prevailing.
Yes, it is correct. B is the correct answer. So we'll have to go to the healthcare.gov to compare all the health plans and enroll themselves. And coming on to the fourth question, say, for example, if you miss the open enrollment period, which is in the month of November, and if you miss it, it's closed and the member cannot enroll. But there are certain circumstances where you can still enroll. Like these are the following options when you want a different plan, when you move to a new state. So in US we have many states, like we have 40 plus states in United States, and you cannot enroll after missing the open enrollment period. Or option D, during a qualifying life event like marriage, birth of child, divorce, or loss of other health coverage. This is a simple one.
Lot of D. Only
Yeah,
D.
yeah, only D.
Yeah, of course.
And who coming on to the last question, who is responsible for filing a healthcare claim? This is one of the easiest question since I've been talking about this lately. It's A, patient, B, healthcare provider, C, insurance company, D, state government.
B, probably.
Yeah, correct. It is B. The healthcare providers do filing for the claims. Yeah,
Okay.
that's all I had as part of the session. If you guys have any questions, please do let me know.
Yes, Rajesh. There is one question in the chat. So, which is asking, what are the KPIs in claim processing? Would you like to answer? Or I can answer?
Yes, Malar, if you can.
Okay. So, in general, the major KPI or the very important KPI is clean claim rate, right? And claim denial rate and days in accounts receivable especially. So these are some major things to analyze whether your claim processing system is a best system or not. But apart from that, I also pasted another very big list that I pasted previously regarding what are the factors that we will consider in the claim processing systems, right? So apart from this claim denial and then this AR payment and etc. So we need to also consider the network adequacy and provider contracting and provider satisfaction. That is also very important. You need to have a good network, right? And then fraud and abuse prevention, because when it comes to claims, you always deal with this duplicate claims and fraudulent crimes and everything. So you need to have a very robust anti-fraud system to prevent all of that. That otherwise, payer will incur a lot of loss. And coming to regulatory and compliance, you especially, let us take this example of Medicare claims. If there is anything that you are doing in Medicare, right? So you need to report it to CMS. Every claim, every claim that is getting registered, everything need to be reported to CMS, and CMS will also perform audit on that. So there are certain programs that require certain regulations that we need to be compliant with, otherwise the license will get cancelled, right? And all this claim processing system, payers and everyone has this accreditation system. There is this popular accreditations that are available, so they will get that actually. And especially while designing your softwares, right? So we need to follow HIT, right? So that HIT is also something that that will give some certification to you. And even if you go to AWS or Azure or anything, you can see HIPAA compliance, right? So especially in US, so what are the software that you do that will have if AWS will also have that certificate, and whatever the system that you do, you can even use AWS to analyze that as well, right? So yeah, that is one thing. And the next question, what do you see as the biggest challenges seen today with the healthcare admin? So, would you like to answer, Rajesh?
Yes, sure, Malar. So the biggest challenges these days, like the healthcare administration faces on the, I would say, the cost management, like because of rising healthcare costs, right? And there are increasing concerns. So the administrator must manage these costs while managing the high quality patient care. So that is one of the major several challenges, and we also have the, I would say, staffing these days, patient satisfaction these days. So because since the healthcare cost is risen up a lot, so the expectation of the patient experience is also increasing, right? So even after paying a huge amount of money uh, during those insurances, patient satisfaction is one of the main thing which the healthcare administrator really pressurize themselves off, and the experiences that focuses on comfort, communication, and well-being, right? So patient satisfaction is needed, and I would say these are the I would the challenges. There is also one more thing on the IT front which clicks my mind right now. It's like integration of technologies, right? So like healthcare has increasingly started being digital these days. So you have everything in your mobile. You can log into your laptop and do everything. You can get all the information. But adapting and implementing these technologies in a secure area is very much a bigger challenge, I would say, because many data leaks happen these days. So there are many breach of data which happens with the patient information, and it's really on a high percentage. So these are the challenges which the healthcare administration system faces along with the IT system. So hope I have answered your question with few of the examples.
Thank you, Rajesh. And there is another question that how do you see the evolving landscape of health sciences impacting the career opportunities over the next decade, particularly with the integration of technology and increasing emphasis on the preventative care? And what roles do you believe will become more prominent? And then what skills should professionals focus on developing to stay competitive in this field? I would like to take this question, Ashok.
Sure.
So, yeah. So here, not only in healthcare industry, whatever the industry you go, Gen AI is prevalent, right? And especially in this preventative care, that is very true, right? So that's why we have value-based healthcare. Previously, we give insurance for the treatment, that they may get some disease or anything, and then they will go to hospital, then only this will come. And vaccines are covered, yeah, previously as well. But then now comes this value based healthcare, right? So that is changing lot of things in the overall healthcare industry, in provider side, in payer side, or even in the industry side, right? So it is changing so many things. Now coming to the technology part, right? So AI, data is everything, data is the money right? So data has a good career, that only from our perspective that we are doing a lot of research on our One Healthcare side. So from our side, we are saying that data has the good prevalence there, and AI, right? So wherever you go, there is AI. So AI has good prevalence in our side as well. So I believe if you upskill yourself in Gen AI and data side on how to integrate these two things into our healthcare, right? So that will definitely help. If you concentrate only on claim processing, so I have already answered you that even in claim processing, there is one company who have automated so many things, right? And there is Olive's AI claims automation platform and Change Healthcare. You might have heard about Change Healthcare. They are doing real-time adjudication, and also blockchains are being used in data security. Example, Guardians Healthcare is using that. And if you go to Aetna Health app, right? Aetna is a very famous payer. So if you go there, you will see, how they are allowing the members to access the claim information, EOBs. Those are very crucial information. So they have lot of security applications there, and they are using so many things to do that, right? And very well asked about interoperability. So interoperability is our future. So because especially in our IT industry, we are focusing more on that, and also we are planning to do some sessions on interoperability in our One Healthcare community. We understand the importance of interoperability and the opportunities in interoperability. So we formed a group of interoperability team, and we are going to do a lot of sessions on interoperability. Not only theoretical session but also practical sessions are also being planned. So that is also one thing that we saw as a very good domain where we have lot of opportunities. Thank you, Ashok, for your question. Hope that answered your question.
Yes, Malad, thank you so much. I just have another consecutive question, a small one.
Mhm.
How do you see or how do you foresee client expectation evolving next few years? As IT guy, what should I be aware of?
If you are asking the healthcare clients, right?
Yeah,
So
yes. Walmart make
healthcare.
us an example.
Okay. So I can answer you from few clients that I saw so far in the opportunities portal and in the staffing desk, right? So
Mhm.
they, even if you go and check, there are so many opportunities, especially in some healthcare clients. There are opportunities for hiring the business analyst or any other engineers, where the project description is they are doing Gen AI POC MVP on their application, whatever it is. For example, Novartis is doing that, and also I saw some other healthcare company which is also doing this POC MVP kind of things in this area. But they're expecting you to be having this healthcare domain expertise, because this is POC MVP, that whatever they are doing, right? So having someone from the domain perspective is also very helpful for them. So that is what I saw. Healthcare, life sciences, this domain being expected. Apart from that, on technology point of view, for business analyst, you just need to be aware of all this Gen AI tool, prompt engineering, etc.
Hmm. Yeah, excellent. Thank you.
Thank you. Any other questions, anyone? Even if you have questions after this session, please post it in the chat. Either me or Rajesh will help in answering. Thank you so much, everyone, for joining this session. This is a very fruitful session, very interactive session. Liked it so much. Thank you for everyone.
Yeah,
Thank you everyone for joining the session.
wonderful session. Thank you.
Thanks,
Have a
Rajeshwar.
nice day.
Thanks, Mala.
Thank you. Have a great day.